Joining us now is KK Shailaja, Health and Social Welfare Minister of Kerala. Thank you very much for joining in, ma'am. You know, Kerala has sort of been constantly under glare, under limelight especially, earlier for some early cases that we saw, and then later on also for that fantastic job you did as far as contact tracing was concerned. What is it that helped Kerala in tackling this pandemic in a much better way?
Actually, we are fighting a war against this pandemic to control it and to tackle it. We started from the beginning. Our preparation started from the beginning. We have some experience with that Nipah case also. At that time, we formed a protocol and also started operating practices and other guidelines according to WHO and also according to the Ebola protocol, etc. And this time also, when the novel coronavirus started spreading in Wuhan, China, at that time itself we started our planning, because we are sure that some people will return from Wuhan to Kerala, because a lot of Malayali students are studying in Wuhan University. And from January itself, we started our preparation and planning. On January 24th, we formed our state control room. At that time, no one came from Wuhan at that time, but we planned. We have very good state control cell, and also we send the message to each and every district, all the 14 districts, that you should be aware that people may come from Wuhan, and you should be aware about this novel coronavirus, and you start the preparation. And all the district also formed control cells in district headquarters. And we waited. As we expected, the people came from Wuhan. From January 30th, we had got a positive case from Wuhan. We screened all the people who came from Wuhan in airport itself, and we got 3 positive cases. January 30th, one became positive and corona positive. At that time, that patient was in our hospital isolation. And another day, the 2nd of February and 3rd February, we got 2 other cases also in 3 districts. They are distributed in 3 districts. But all were in hospital isolation, so we can manage it, and from them, no other contact cases occur. We tackled that things in the first stage, and it was a victory. But we found that the coronavirus is spreading from China to other countries. And Italy, there is a great spread. And at that time, people came to Kerala from Italy also, and we strengthened our airport surveillance and other thing. And also we continued our precautionary measures and all the stringent actions we took. But from airport, some people we cannot identify, because they didn't reveal the place where coming back, and they went to home. And from one Italy case, there is a culture formed in one district from that one case, and several other people got infected from them. But right, at once the system is ready to trace the contact of the Italy returned, and we trace the contact in a good way.
Right.
So that we can get all the contact peoples.
Right.
That is that method, the surveillance, the tracing, etc.
Yes, yes. One of the things that everybody is saying generally,
yes,
not just Kerala, that we watched out much more for Asia, East Asia, China and East Asian countries, and we didn't quite think the West would be so quickly infected. But I must say, if you had to list the states, how they've handled this, Kerala is really top of the list right now. And Mr. Pinarayi and his daily press conference is a bit like Cuomo of New York. But just a tricky question to ask you. Are you going to extend the lockdown? And number one is lockdown within the state, and the other is interstate movement. What are you going to do about that? Are you going to open that up after April the 15th, or is this all going to be extended?
It's up to central government. Honorable Prime Minister in a video conference asked us what is the state's opinion about the lockdown, and he also informed us to send our opinion after April 14th, what we are liking to do. And we formed an expert committee. Our Honorable Chief Minister formed an expert committee with all experts from all sector of the community, 17 peoples, and they are now discussing about the method what we have to follow after the withdrawal of the lockdown. We think that we cannot fully come out of the lockdown, but some measures we can reduce that stringent instructions, but in some extent we have to have that all the lockdown systems in certain sector.
Right. Thank you so much for speaking with us.